I'm Joe Graedon.
And I'm Terry Graedon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Starting a new medicine is surprisingly easy. On the other hand, stopping many medications can become a nightmare. This is the People's Pharmacy with Terry and Joe Graedon.
The Food and Drug Administration refers to withdrawal symptoms as discontinuation syndrome. This terminology is applied to opioids, of course, but also to antidepressants.
Stopping drugs ranging from antihistamines and nasal sprays to acid-suppressing drugs and anti-anxiety agents can lead to unpleasant or even intolerable reactions.
The FDA provides prescribers, pharmacists, and patients little, if any, guidance on how to discontinue medications safely. Why is this problem a secret? In the People's Pharmacy Health Headlines, as the FDA considers whether to approve a new drug, donanemab, to clear amyloid plaque from the brain, a randomized controlled trial demonstrates that lifestyle changes can make a big difference against Alzheimer's disease. The scientists recruited 51 adults diagnosed with mild cognitive impairment or early dementia due to Alzheimer's disease. Most were in their 70s. For 5 months, half the volunteers received usual care, while the other half were coached in making important lifestyle changes. They switched their diets to emphasize minimally processed plant foods with very little fat, refined foods, alcohol, or sweeteners. They engaged in strength training and aerobic exercise for at least half an hour a day. In addition, they learned meditation and other stress management techniques and practiced them daily, and they attended support groups for the study participants and their partners 3 times a week. Extensive cognitive testing at the beginning and end of the trial showed statistically significant improvement in 3 out of 4 standardized measures used. In contrast, people in the control group continued to get worse.
An FDA advisory committee just recommended that the Food and Drug Administration should approve the drug donanemab. This anti-amyloid monoclonal antibody is designed to reduce amyloid plaque in the brains of patients with Alzheimer's disease. Patients with dementia did not improve their cognitive scores. They got worse more slowly than those on placebo. None of the anti-amyloid medications that have been tested over the last decade have actually improved cognition or activities of daily life. The best they can do is slightly slow deterioration. This has led some researchers to question the anti-amyloid approach to treating Alzheimer's disease.
One lasting challenge from the COVID pandemic is a condition called post-acute sequelae of SARS-CoV-2, more commonly known as long COVID. A study tested the anti-COVID drug Paxlovid in a 15-day randomized clinical trial. The investigators recruited 155 long COVID patients suffering from moderate to severe symptoms. These included brain fog, fatigue, shortness of breath, digestive distress, cardiovascular symptoms, and body aches. The researchers report that a 15-day course of Paxlovid was generally safe but ineffective. They conclude that further studies are needed to determine the role of antivirals in the treatment of long COVID.
Xylitol is a low-calorie natural sweetener that's frequently used as a sugar substitute. It can be found in chewing gum, toothpaste, candy, ice cream, peanut butter, and baked goods. New research published in the European Heart Journal indicates that xylitol increases the clotting potential of platelets. This in turn might lead to an increased risk for problems such as heart attacks, strokes, and pulmonary embolisms. The investigators identified xylitol as a potential risk factor from a large panel of blood samples. Then they examined the effect of this sugar alcohol on platelet function. Finally, they gave volunteers a xylitol-rich drink and studied how platelet performance changed. They concluded that xylitol enhanced platelet reactivity. As a result, they believe this sugar substitute could increase the risk for major adverse cardiovascular events.
Epidemiologists and biostatisticians have some bad news for Gen Xers. It comes from a study looking at cancer rates in cohorts born between 1908 and 1983. The data from a cancer registry show that people born between 1965 and 1980, also known as Generation X, have higher rates of many types of cancer than any previous generation. That includes their baby boomer parents. There is some good news. Rates of lung and cervical cancer have fallen. Unfortunately, the rates of several other types of cancer have increased in this younger cohort. The authors conclude that cancer incidence in the U.S. might remain high for decades. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graedon. I'm a medical anthropologist.
And I'm Joe Graedon. I'm a pharmacologist. Today, our topic is getting off the medication treadmill. How can you stop taking medicines you no longer need? We invite you to join the conversation. 888-472-3366. Have you ever had difficulty stopping a drug? You can email us your questions and share your story at radio@peoplespharmacy.com.
When you get a new prescription, you ask how long you're supposed to take the medicine. In some cases, such as hypertension, diabetes, or heart disease, may be indefinite. But when it comes to conditions like insomnia, allergies, indigestion, or depression, you may not plan on taking the medicine forever. Should the prescriber provide a plan for discontinuing the drug? In a few minutes, we'll take your calls about your experience stopping drugs like proton pump inhibitors, anti-anxiety medications, sleeping pills, and antihistamines. That number again, 888-472-3366.
But first, we turn to Dr. Richard Friedman, professor of clinical psychiatry and the director of the psychopharmacology clinic at Weill Cornell Medicine. His specialties include anxiety and mood disorders, psychopharmacology, and refractory depression.
Welcome to the People's Pharmacy, Dr. Richard Friedman.
Hi, pleasure to be here.
Thank you, Dr. Friedman. We read your article in the Washington Post a couple of months ago, and we were fascinated by the case history that you provided about a 52-year-old patient who came to you with severe depression. Can you describe what happened when he asked you a very important question?
Oh, he asked a critical question, which was, can I get off my medication at some point?
And which medication was that, and how long had he been on it?
He was on a SSRI antidepressant, and probably he had been on for a couple of years. I can't remember the exact number. I'm not looking at the article, which I wrote, as you say, a couple of months ago. But he was on a standard antidepressant that we use for, major depression, which is what he had. And he had been well for a very long time on the antidepressant.
And why did he want to stop?
He wanted to stop because he had been well for so long, and he wondered, did he still need to be on the medicine to stay well?
Now, Dr. Friedman, as you say, that's an important question. It's a sensible question. I mean, some people would just stop taking it. And then, as we understand it, if they're on an SRI, some people don't do that well if they just stop taking their antidepressant suddenly. Can you tell us more about that?
Right. Well, just in general, when you start a treatment for a medical problem, in this case, it's depression, you have to tailor the treatment to match the problem. And for depression, let's say, about half of people who have an episode of depression will go on to have more depression in the future. And if you've had a couple of episodes, let's say in the last 5 years, the chances you're going to have more episodes in the future is, more than 90%. So the question about how long you should be treated and how long you should stay on your medicine depends on the individual history that you've got. And that determines the risk. So, if you've just had one episode of depression, for example, standard treatment would be 6 months to a year of an antidepressant, and then we taper you off of it and see how you do off the medicine. We don't presume that you're going to need medicine lifelong unless you have a history of multiple episodes, many episodes of depression.
Now, Dr. Friedman, in this really well-written and fascinating article, you suggest that doctors are experts at prescribing medications, but not so good at the critical art of knowing when and how to stop them. Why is that?
Well, because I think our training teaches us to do as much as we can to relieve suffering. And the goal is remove symptoms, treat the disease, get the person back to feeling as good as they possibly can. That's the emphasis. But what is not emphasized is once you do that, how long should you continue the treatment? And if it's an acute disease, the obvious answer is, clear to most people. You have a strep throat, you have a course of antibiotics, you stop it. You have an ulcer, you get a course of, antacid or a proton pump inhibitor, and you can stop it. On the other hand, if you have elevated cholesterol or you have hypertension, those are chronic diseases, and you need to be on lifelong treatment. So, it depends on the nature of the problem. And, and then there's everything which is in between, an acute problem and a chronic problem. And it's those conditions where there's a lot of variability in the nature of the medical problem, where the judgment of the doctor has to be exercised to decide, okay, how long is long enough?
Well, Dr. Friedman, as a psychiatrist and as the director of the psychopharmacology clinic at Weill Cornell, you deal with a lot of those in-between situations. I wonder if you can tell us what happens if somebody just stops taking, let us say, an SSRI antidepressant.
Right. So it would depend on what their history is like. So if they've been stable for a long time, initially, if they stop the medicine suddenly, they could have discontinuation effects. They are largely medically harmless, but they could be uncomfortable. Flu-like symptoms, zaps, things like this.
Zaps. I'd like you to tell us more about zaps, please.
The zap is a sensation of, like a sensation in your head that you feel almost like an electric shock. Or, you just feel off. Something is not right. Your concentration.
We've also heard that some people feel dizzy.
Yes. Dizzy, lightheaded, achy, fluish. Those are typical symptoms you can get when you discontinue a medicine too quickly. If you do it slowly, though, it's very rare that happens. It's like going down in an airplane.
Yeah, but we have read the Food and Drug Administration's official prescribing information, and they often say slowly or taper the patient. But, those are words that I like to refer to them as fat words. That is to say, they can be interpreted in all kinds of ways. So one physician may interpret slowly as 2 weeks. Another might interpret that as 2 months. And we've heard of some patients, for example, those on duloxetine, Cymbalta, may take as long as 6 months to a year, literally removing one bead out of the capsule every week. So what do we mean when we say slowly?
That's a wonderful point. To me, these are not, these are guidelines, and it's designed so that information helps guide what you do with individual people, which means some people can be tapered more quickly than others. And so you begin, it's like each person, each treatment has to be individualized. So some people can come off medication rather quickly. and have no symptoms of discontinuation at all. Some people actually go on vacation, they forget their medicine and they have nothing happen. Other people, you reduce it by 10%, every 2 weeks, and they feel headache and dizziness. So there's a huge variability in response, both to treatment, side effects, and discontinuation. So the answer to your question is, it depends on the person. And once you start the process of discontinuation, I always say you go down by 10%, every week, and then you see how quickly can you go down. It's like what happens when you go down in an airplane. The slower you do it, the less likely you are to feel discomfort. Some people are incredibly sensitive no matter how slowly you go. That's just human biology.
Dr. Friedman, what we'd like to ask you is, should doctors and patients discuss a plan for stopping the medication before the patient even starts a medicine?
Yes, they should talk about what's expected when you start a medicine, which I do all the time with patients. And I say, we're going to begin this treatment for depression. The nature of your depression is you've had, let's say, this is the first episode. I expect you're going to need medicine for 6 months to a year, and after that, we're going to stop it. Or somebody else, you've had 8 episodes of depression in the last 15 years. You have a chronic problem. You're going to need long-term treatment. Once we start the medicine, you should probably not stop it. So again, it depends on the history.
And I assume that's also true of drugs like benzodiazepines, anti-anxiety agents, or, sleeping pills. Perhaps you can help us in the minute or so that we have left. If you were a patient, what should you be asking your doctor when you get a new prescription, especially for a psychotropic drug, your specialty? What would you encourage your patients to be asking their clinicians when they get a new script?
Wonderful question. I would say, ask your doctor, why are you giving me this medicine? Are there other alternatives? What made you pick this? What are the pros and cons? How long do I need to stay on this medicine, and why? In other words, you really want to understand the nature of your problem. You understand the rationale for the decision your doctor made to give you a medicine, why that medicine and not another one, and also how long you need to be on it and what kinds of side effects you can anticipate.
Dr. Richard Friedman, thank you so much for talking with us on the People's Pharmacy today.
My pleasure.
You've been listening to Dr. Richard Friedman. He is professor of clinical psychiatry and director of the psychopharmacology clinic at Weill Cornell Medicine.
Have you ever had difficulty stopping an anti-anxiety medication like Xanax, known by the generic name alprazolam?
What about an antidepressant such as sertraline, venlafaxine, or duloxetine, known by its brand name Cymbalta?
Our lines are open for your stories and your questions. 888-472-3366. Email us, radio@peoplespharmacy.com. That number again, 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graedon.
This podcast is made possible in part by CocoVia, maker of the most proven and concentrated flavanol extract in the market today, CocoPro Cocoa Extract.
June is Brain Health Month, so play it smart and improve your cognitive function and long-term memory with the support of CocoVia Brain Health Supplements. Improve memory and brain function in 8 to 12 weeks with Memory Plus, or support 5 areas of brain performance with memory and focus. The choice is yours. All CocoVia supplements contain the #1 proven source of flavanols, CocoPro, backed by more than 20 years of research.
Get 20% off all CocoVia Brain Health products from June 10th through June 24th using the discount code BRAIN2024 at cocovia.com. That's BRAIN, BRAIN 2024, all uppercase 2024 at cocovia.com.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. Welcome back to the People's Pharmacy. I'm Terry Graedon.
And I'm Joe Graedon. The People's Pharmacy is made possible in part by Cocovia Dietary Supplements. June is Brain Health Month, so keep cocoflavanols top of mind for cognitive function and long-term memory support. How can Cocovia be a part of your supplement routine? More information at cocovia.com.
Today we're talking about how to get off the medication treadmill. Have you ever had difficulty stopping a decongestant nasal spray like Afrin, an acid-suppressing drug such as Prilosec or Nexium, or an antihistamine like Zyrtec or Zizal?
We'd love to hear your story. Our lines are open for your experience and your questions about how to get off the medication treadmill. The number, 888-472-3366. You can email us, radio@peoplespharmacy.com. Do you have a story to share or a question about antidepressants like sertraline, paroxetine, or duloxetine, or anti-anxiety medications such as diazepam or alprazolam? Our number again, 888-472-3366.
In the last segment, Dr. Richard Friedman of Weill Cornell Medicine suggested a number of questions that patients should ask when a healthcare provider suggests a prescription. The first one is, why are you giving me this medicine?
Are there any alternatives?
What made you pick this one?
What are the pros and cons?
How long should I stay on the drug, and why?
Are there side effects I should be aware of? And I would add one more, Terry. When it comes time to stop this medication, how should I discontinue it?
Well, those are all really good questions, and hopefully we'll get some good answers when we ask them. But what if you're taking a non-prescription medicine? There's nobody to ask about the side effects, the alternatives, and what might happen when you stop. Sometimes you can get quite a surprise.
Well, Jerry wrote, I experienced intense itching when I stopped taking Zyrtec. I took it for a couple of years for seasonal allergies. The first year, the itching was tolerable when I stopped. The second year, it was worse. I'll never take it again. I don't think my primary care doctor believed me when I told her about it. What about you? Have you ever taken an antihistamine and then discovered you were itching when you stopped? You can join the conversation, 888-472-3366, and you can email us your questions. That email address, Terry?
radio@peoplespharmacy.com. And we'd like to talk to Donna in Abingdon, Virginia. Donna, welcome to the People's Pharmacy. Tell us your story.
Oh, hello.
Hi, Donna.
Yes,
What's going on?
Well, I just wanted to call. I was listening to your show this morning as I was driving, and I have just recently gotten off all of my psych meds that I've been on for 20 plus years, and it's been a roller coaster ride, but it's taken me about 6 months to get off the medicine. The one that really was very difficult was the Effexor.
Venlafaxine, yeah.
Tell us what it was like.
That one was tough.
What?
It was, you mentioned the brain zap. You mentioned, I don't think you specifically mentioned the nausea, but nausea, just not be able to pretty much concentrate. It took me a while, and it was really difficult because my doctor, unfortunately, my doctor retired, and I, in the middle of all that, and I got a new doctor, and it was kind of like going through a drive-through. You know, I'd pull up and say, yeah, I want to get off my meds now. And she would say, well, here, I'd then go up to the window and she'd hand me the new prescription. That was about as much counseling as I got. So I really appreciate shows like yours that help educate folks like me.
Now, Donna, we keep hearing this thing about brain zaps. And I'm not sure our guest really explained what it's like. Can you give us some sense of what it feels like to have a brain zap?
I really don't have the vocabulary to medically describe that. I think that it's almost like a blinking, but you're not blinking your eyes. It's like your brain is blinking, and it is, kind of actually a little zap, like maybe if you shuffle across the carpet and you touch something, you get that little shock. It's kind of like that, but it's in your head, and it's scary.
It does sound really unpleasant. Well, Donna, we are very glad that you have finally gotten off the venlafaxine, and it's good to know that it can be done, but it does require some careful effort, and it is good to have counseling while you're going through it.
Thank you for the call. Bye-bye. 888-472-3366 is the number if you would like to join the conversation. You can email us, radio@peoplespharmacy.com.
Joe, we got an email from Ken who says, I'm quickly approaching retirement and I will no longer require caffeine. Now, if I abstain from caffeine, I experience wicked headaches within 24 to 36 hours. This is actually not a surprise, is it?
No, it's not.
Tellingly, just a few sips of a caffeinated beverage alleviates the headache in a minute or less. How best can I get off caffeine? Is there a route to decaffeinating myself?
Well, what's so interesting about Ken's message is that when people have to go into the hospital for surgery, for example, and they're told, well, you have to stop drinking coffee prior to surgery and probably post-surgical as well, they sometimes experience exactly that kind of withdrawal headache. And it can be really horrible.
Yeah, it can be a horrible headache.
And so we don't have a good way to taper it unless you plan ahead for the surgery. And in Ken's case,
He's got time to plan ahead.
He's got time. And so he needs to be very gradual. And I think that is kind of the key to a lot of this getting off the treadmill process.
So if Ken were drinking 2 cups of coffee a day now as he goes to work, maybe he cuts back to a cup and a half over the next month or so, and then just 1 cup, and then 3/4 of a cup or half a cup.
And then maybe a little decaffeinated coffee in between. And then gradually, perhaps he will be successful.
Good luck with it, Ken, and let us know how you do.
Again, that email address, if you'd like to share your story or ask a question, radio@peoplespharmacy.com. And the number, Terry.
The number is 888-472-3366, and we will talk to Leah in Greensboro. Leah, welcome to the People's Pharmacy.
Hi, I've got a couple of questions about a medical situation that recently happened. An elderly family member was in the hospital for a bad fall when she suddenly started becoming delirious and she lost her words and she started having spastic muscle movements. A geriatric nurse practitioner believed that this was serotonin syndrome, possibly caused by interactions of some of the medications that she had at home. She had been on, he said the problems were Lexapro and Trazodone. And unfortunately, a family member who was there had brought home medications and given them to the patient while she was in the hospital. So a little unsure as to whether that might have caused the problem or maybe if it was the medications had built up in her system. About a week later, she came out of it, luckily, wonderfully. And when a neurology team saw her at that point, they said, Well, we don't really think this is serotonin syndrome. So there were lots of medical teams involved. I'm wondering, how likely was it to have been serotonin syndrome? Is there any way to know? And is it likely that these medication interactions caused it?
If I had to guess, and of course it's always very difficult to play, Monday morning quarterback, but
And we do have to say we can't actually know, and we don't know of any way that the doctors could know for sure.
But if you look at the drug interaction information on drugs like Lexapro and Trazodone, there is that possibility. Now, I have to be honest with you, Leah, this is personal for me because my mom went to Duke for a cardiac procedure, and she was on what's called an MAO inhibitor, and she was given a drug that was supposed to be a pain reliever. And unfortunately, it triggered serotonin syndrome, the exact kind of symptoms that you're describing, uncontrollable muscle movements, and it ultimately led to her death. So this kind of interaction is far more common, I think, than most people realize, and it has a whole bunch of symptoms from relatively mild to literally life-threatening. And so I encourage people who are on more than one psych drug, which is what was happening to this person, they need to check that interaction checker that comes with any computer in a medical office to see if, in fact, some of those symptoms could be related to that combination.
Now, the patient herself might not have been able to go online, so it would have been up to someone else in the family, Leah, who would be able to do that checking.
And you can't just discontinue either of those drugs suddenly, but you have to be very cautious. And in the hospital, it's going to exaggerate everything. But thank you so much for the call and for, letting people know how important that serotonin syndrome condition can be. Again, our lines are open for your calls and your questions and your stories. 888-472-3366. You can always email us, radio@peoplespharmacy.com.
And Joe, we have an email from Patricia in Texas who has an important discontinuation question to which we urgently need an answer, and we really don't have a good one. Patricia in Texas wrote, I'd like to know how to discontinue the osteoporosis drug Prolia without risking fractures. From my understanding, even transitioning to another osteoporosis drug doesn't lessen the risk very much. I had no idea of this risk when my doctor first proposed that I go on Prolia.
What a great question.
It is a great question, and this is a problem with Prolia that has fairly recently come to the surface.
Well, perhaps there's a health professional listening who can give us a call or send us an email and tell us how to transition off Prolia, because sometimes people do experience side effects from their osteoporosis medicine.
Right, and so the issue would presumably be to start taking another osteoporosis drug. But we would love to have some details on that. All right, let's go to Robert in Tampa, Florida.
Hi, Robert. Welcome to the People's Pharmacy. What's on your mind today?
Good morning. Thanks for taking my call. I just wanted to share how I got off high blood pressure medicine, and it was literally just through ingesting beets. So if please share that with me.
Whoa. We need details,
we do
Robert.
Need some more details.
When you say beets, what exactly do you mean?
So I went to see my primary some time ago. He said as I've gotten older, my blood pressure was a lot higher than what it was. So he handed me a prescription, and I'm a little anti-prescription, to be candid. And I literally walked into my health food store, and ironically enough, the woman behind the counter, her mom was going through the same situation. She handed me beet juice, and then I just started ingesting just over the counter at Publix Beets. And I haven't been on high blood pressure medicine for, it's been 10 years.
So you actually eat beets? Or do you just drink beet juice?
Oh, no. I eat them. I kind of inhale them.
Okay.
So I have a personal question to ask.
Please.
Do you pee red?
No, God, no. No, I don't urinate red.
Okay. Well, some people do when they eat beets, and it's okay.
And they get scared because they think they're bleeding, but it turns out it's just the beets. And because beets are, in fact, very red. So beets worked for you, Robert. Thank you so much for sharing that, because, the point you're making is important. There are a lot of folks, about half the American population, who have high blood pressure. And obviously, hypertension increases your risk for strokes, for heart attacks, other cardiovascular complications. So tens of millions of people are taking blood pressure pills. But there are some things people can do for controlling hypertension, including eating beets. The mechanism?
Well, the mechanism is that the beets contain nitrates, which the body uses to produce nitric oxide, which relaxes the blood vessels. And when you relax those blood vessels, Joe, the blood pressure goes down.
So
Cocoa flavanols, I should say, not chocolate, but cocoa flavanols can do something quite similar. But it's probably much healthier to eat beets every day than to eat chocolate every day.
And then there's the DASH diet, which stands for
Dietary Approaches to Stopping Hypertension, and it is full of vegetables and fruits, and it is very effective at controlling blood pressure, usually without medication.
And there's a lot of research to support that. So no question that the DASH diet works. And exercise, Terry, let's not forget exercise.
Exercise is important. Also, meditation, spending some time in nature, all of those things are very helpful for your blood pressure.
So do we have another email you'd like to read, Terry?
I do, actually, Joe. I have an email here from Audrey who says, as a nurse, I've worked with veterans under the age of 40 taking amphetamines like Adderall for the long-term impacts of traumatic brain injuries. After they suffer a heart attack, the cardiologists take the patients off the Adderall because they have heart risks. Some of them have a really hard time coming off the medications. Are there any recommendations for that?
Well, why that's so critical right now is there has been quite a shortage of Adderall and some of the other stimulant medications, and you really can't stop these drugs suddenly, but for many patients, just getting a hold of the medication can be really a challenge. So it's not like they want to stop. It's like it's an enforced stop because they can't get the medicine. Well, we need to take a short break. But when we come back, we're going to take more of your calls, more of your questions, and share your stories. The number 888-472-3366. Our email is radio@peoplespharmacy.com. Have you ever had trouble stopping an antihistamine like Zyrtec or Zizal?
Or a proton pump inhibitor like Nexium or Prevacid?
We'd love to hear from you. 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graedon.
This podcast is brought to you in part by the People's Pharmacy and our exclusive line of magnesium-rich roll-on deodorants, crafted with years of expertise and community feedback. Our customers rave about their ability to control odor effectively without aluminum. These deodorants are a superior choice for daily health and comfort.
Each is designed to be gentle yet highly effective, providing reliable odor control without aluminum or other harsh chemicals. Plus, They're incredibly easy to use and long-lasting.
As a special offer for our podcast listeners, enjoy an exclusive 20% discount on any size of our deodorant. Choose between the handy 2-ounce scented or unscented varieties or the economical 3.38-ounce unscented version.
Simply visit the body care section in the store at peoplespharmacy.com and enter the promo code POD20, that's POD 20, during checkout to redeem your discount. Remember, this promo code POD20 gives you 20% off your purchase of our top-rated magnesium-rich, aluminum-free roll-on deodorants until August 2024.
Welcome back to the People's Pharmacy. I'm Joe Graedon.
And I'm Terry Graedon. The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. June is Brain Health Month, so keep cocoa flavanols top of mind for cognitive function and long-term memory support. How can CocoVia be a part of your supplement routine? More information at cocovia.com.
We'd love to hear from you about getting off the medication treadmill. Our lines are open for your experience and your questions about how to get off drugs. The number 888-472-3366. You can email us radio@peoplespharmacy.com.
A surprising number of drugs, both prescription and over-the-counter, can trigger unexpected and often unpleasant reactions when you stop taking them. A few weeks ago, we discussed homeostasis with Dr. Terry Graedon and Dr. Robin Chutkin. When the body adapts to a medicine, removing it suddenly can disrupt a lot of things.
Well, there's one type of medicine that can be really hard to quit suddenly, and that would be what we call a PPI, a proton pump inhibitor. And you might recognize some of those generic names like omeprazole, esomeprazole, and lansoprazole. You certainly recognize the brand names, Prilosec, Nexium, and Prevacid. Stopping any of these medicines suddenly can trigger rebound heartburn. Terry, we talked to a Danish researcher over 15 years ago about her PPI withdrawal study, and these were people who did not have heartburn to start with. They were 120 healthy volunteers. It was published in the journal Gastroenterology in 2009, and there was a quote, and that is, PPI therapy for 8 weeks induces acid-related symptoms in healthy volunteers after withdrawal.
Right. And that was somewhat unexpected. I mean, that was why she was doing the study, to see whether the much more serious heartburn that people were reporting after they stopped these drugs was a result of their underlying disease or was a rebound effect. It turned out to be a rebound effect.
So what's the strategy? I think Dr. Terry Graedon came up with some very interesting ideas on how people could get off PPIs without experiencing unbearable heartburn.
Well, first you want to reduce the dose very gradually. Sometimes doctors say go from once daily to once every other day for a few weeks. And for some people that works, and other people need to go even more gradually. An oral disintegrating tablet can help if you have to go more gradually. Or a PPI that comes in capsules that you can open and just take out a few of those little sprinkles. And you might find it helpful to use an H2 blocker like cimetidine or famotidine.
So we're talking Pepcid or Tagamet.
Or an antacid like Tums. And also, some people find that going to a low-carb diet can be helpful in controlling.
And Dr. Graedon has also talked about something called DGL, which stands for
deglycerinated licorice, and it can be helpful.
So where to next?
Well, I think we should talk to Donald in Baltimore, Maryland.
Hi, Donald. Hello, Donald.
Maybe we can't talk to Donald in
Hello?
Baltimore.
Can you
There
hear
you
me?
are.
There you are, Donald. What's on your mind today?
I just want to make a comment. I started reading that little, I call it a cash register tape, that's in every medication that's over the counter. And as you know, when you get a prescription, the pharmacist will give you a sheet with some information on it. It's my experience that when you read that actual little cash register type thing, it's in they come with the over-counter medication, it's the information is invaluable. The thing that I focus on more than anything else, sometimes the reading can be somewhat challenging because of all the medical terminology, but at the end of the day, as I said, it's invaluable. I was taking Protonix years ago for good, and after I decided to read the information that comes with the prescription, the cash register type thing that I'm describing, I immediately stopped taking the Protonix. The long-term effects of Protonix was a risk that I didn't want to take.
Well, thank you for encouraging people to read that OTC label and any information that comes with it. You know, I think a lot of people, how do I describe this? You know, they buy a product that they have to assemble, and they somehow don't want to read the instructions, so they think they'll try and put it together on their own, and that almost always leads to disaster. It does for me anyway.
Sometimes it works, but you really shouldn't do it that way when it comes to medications.
No, you really should read the label and see what the right dose is, what the side effects are. But here's the problem, Terry. You know, many years ago, we discovered that when people were taking an antihistamine like Zyrtec or Zysal, that sometimes when they stopped taking it, they developed this unbearable itch. I mean, it was just excruciating, and the itch would last for not just a day, not just a week, but sometimes a couple of weeks.
Or even up to 6 weeks.
And they didn't know what to do about it.
What they often did was go back on the antihistamine.
And the
that
itch would go away.
It would.
But it was like, wait a minute, what's going on here? So we contacted the Food and Drug Administration. We had some interaction with the director of the Office of Surveillance and Epidemiology, Dr. Gerald Dalpan. They did some studies, and they said, oh, yeah, as a matter of fact, that's true. And they changed the labeling on the prescription product. Rebound pruritus, which is itching, within a few days after discontinuation of cetirizine, usually after long-term use, after months or years. But for some people, it's only after several weeks. So they did change the labeling on the prescription version.
But you can't find it on the non-prescription.
Exactly. Not a word about withdrawal.
Which is a disappointment, because people should be informed about non-prescription hazards the same way. We are talking to Maxine in Dallas, Texas. Welcome to the People's Pharmacy, Maxine.
Hello, Maxine.
Hello?
There you are. What's on your mind, Maxine?
Who, me? You're talking me?
Yes, we're talking to you, Maxine.
We understand you have had some success getting off a proton pump inhibitor, and we'd like to know how you did it.
Okay. I took Nexium for probably over 10 years because I had bad acid reflux. And I started having pain, I'm going to say around my kidney area. And I think it was probably from that, and I stopped taking it. But I also changed my diet because I liked a lot of acidic foods, and I just changed my diet. But and I didn't need it anymore anyway. So that's basically what I wanted to say.
Did you have any strategy for getting off the Nexium, or did you just stop taking it and that was fine?
I just stopped taking it because I think it was affecting my kidneys.
Well, you know, it's a really important point that you're making, Maxine, because I don't think a lot of people realize that proton pump inhibitors like Nexium, like Prilosec, like Protonix, can affect the kidneys. And so even though I take it you didn't have a kidney function test, you suspected that there was a potential problem. And in your case, that might have been a very good thing to do.
We're glad to hear that you didn't have any trouble stopping. Thanks for the call, Maxine.
But Terry, this idea that proton pump inhibitors can affect kidney function, it comes, I think, as a surprise to a lot of people. But it has become a very serious concern in the last several years.
We have an email, Joe, from Barbara, who says, many years ago, I was addicted to my nasal spray. I carried a bottle in my purse. I had one in my desk at work, on my bedstand. After several years, I made the decision to try to get off it. I did it one nostril at a time. For a while, I only used the spray in one nostril until that side eventually stayed open with the spray. And after that, I stopped using it in the other nostril. So that is how Barbara gradually weaned herself from the decongestant nasal spray that she had become accustomed to.
You know what, Terry? Some people use a corticosteroid spray, a nasal spray, because you can get them now over the counter.
They are now available, yes.
And that can ease the inflammation when you stop taking them. Other people actually buy
saline spray.
Saline spray.
And gradually dilute the decongestant.
Exactly.
Shall we talk to Gail?
Surely.
Gail, welcome to the People's Pharmacy.
Hi, I'm Gail, and I live in a rural area in Texas. I only have taken vitamins for most of my life, but I was recently diagnosed with Alzheimer's. And after seeing, I guess now 3 doctors, I'm on 5 different medications. And I think my cognitive abilities are better, but I have other issues that I worry about. Sometimes I have severe diarrhea, and I just was wanting to know, I'm listening to your show, and why am I taking it? So the medications I'm taking, and I don't even know how to pronounce them, discontinuing. Another one is fluoxetine. Another one is Ambien. I've written in the name that I know it by.
Mm-hmm.
Another one that I'm going to be taking, they want me to start it next week, is memantine.
Mm-hmm.
And another one is the Zonapil. And I may have already said that one. That might be a refill. Yes, it is.
So, Gail, we cannot make a recommendation because only your physician can really determine what's appropriate for you. And I'm guessing that you're having some sleeping problems, which is why the doctor has prescribed Ambien. But that does concern me just a bit because for some people, Ambien, although it does help them go to sleep, it can have what we would call cognitive dysfunction side effects. So you might be a little confused, you might be a little drowsy, you might be a little unsteady in the morning, and that would be worrisome. So I would encourage your health professionals to look over that list to make sure that there's nothing there that's going to cause problems, because some of the GI symptoms that you're describing could be associated with one of those medications, and that can be a really distressing problem because sometimes it could come on suddenly and be a real complication.
So we'd suggest, Gail, that you make sure that you take either the list or the actual pill bottles to your next appointment, and make sure that whoever you are seeing really looks at the possibility of interactions.
Terry, we have an email from Brenda. She says, the nightmare of withdrawing from a benzo, that's a benzodiazepine, is really bad. I was on Xanax once a day for 20 years, then put on Valium for another 6 years. I tapered slowly, and I've been off now for about 10 months, and I still have horrible symptoms. My worst was dizziness, no balance, severe insomnia. It's a horrible drug. I was ignorant as to the trouble I would face after being on this drug. I feel for anyone who is going through this torture. I pray every day I will live long enough to come out as a normal, functioning person so I can enjoy what life I have left. Ouch.
Yeah, for sure. And Joe, we actually also have an email from Holly who wants to talk about the Zyrtec problem. She says, I've been going through the same thing with cetirizine withdrawal. The itching is so bad. I asked a friend of mine who's an ER doctor if there was anything that could help with the itching besides Benadryl, because that makes me sleepy, or actually getting a prescription for steroids, which I don't want to do. He suggested I take an H2 blocker like Tagamet. That seemed odd to me, because, it's for acid reflux, but it does block histamine, and it seems to be taking the edge off. I hope this helps someone.
We have only a few minutes left. If you'd like to join the conversation, share your story, or ask a question, 888-472-3366. You can email us, radio@peoplespharmacy.com.
John, welcome to the People's Pharmacy.
What's this about blood pressure pills? Yeah, go ahead, John.
Hi. So I live in Raleigh, North Carolina at 400 feet elevation, and I had an interesting experience with blood pressure pills that I thought I'd share for everybody's benefit. I had an opportunity to be a digital nomad, so I went to Colorado and I rented a cabin at 9,000 feet, and with previous experience with diuretics, I'm on 2 different type antihypertensives. It is really difficult to try to ski and have a nice day skiing if you have to stop and use the washroom every 30 minutes. So I begged my doctor there. I said, please, is there any way I can get off of this antihypertensive? And we talked about it, and I discovered, of course, there's multiple classes of antihypertensives. And so he said, okay, well, let's try this calcium channel blocker, which I did. And, I said, okay, here's what we're going to do. Or he suggested, take a blood pressure monitor, stay on top of it, make sure that your blood pressure is within parameters and all that. And so I was alarmed because my blood pressure did inch up, and I wasn't sure if it was the elevation, which I discovered higher elevations, your blood pressure does go up. So I stopped it, and I went back to the hypertensive, and the hydrochlorothiazide.
John, we just have 30 seconds before we break. Quickly, wrap up.
But anyway, I came back to Raleigh elevation, and I went on a higher dosage, and it worked. So I guess that's the lesson I'm sharing.
Well, thank you for that. We have just run out of time. Thank you for your story. But the idea of monitoring your blood pressure, really critical.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wodarski engineered. Dave Graedon edits our interviews. The People's Pharmacy theme music, B.J. Liederman.
At the start of the show, we heard from Dr. Richard Friedman. He's professor of clinical psychiatry and director of the psychopharmacology clinic at Weill Cornell Medicine.
The People's Pharmacy is made possible in part by CocoVia dietary supplements. June is Brain Health Month, so consider cocoflavanols as part of a cognitive function and long-term memory support system. How can CocoVia be a part of your supplement routine? More information at cocovia.com.
Today's show is number 1389. You can find it online at peoplespharmacy.com. You could subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. That's where you can share your thoughts about this show. If you couldn't get through to share your story, you can still email us, radio@peoplespharmacy.com.
If you go to peoplespharmacy.com, you can sign up for our free online newsletter. It's an easy way to stay on top of the breaking health news. By subscribing to our newsletter, You'll also have regular access to our weekly podcast and find out ahead of time which topics we'll be covering. And remember those questions that Dr. Friedman suggested. Ask your doctor about side effects and how to withdraw when you start taking your medicine so you'll know you have a plan in place. In Durham, North Carolina, I'm Joe Graedon.
And I'm Terry Graedon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.